Mthatha, the economic hub of the rural heartland of the Eastern Cape, surrounded by 10 smaller towns, but unemployment is rife, especially among young people, driving many to suicide with an easy access to a lethal chemical.
There are a number of cases of patients that were treated with some admitted at Nelson Mandela Academic Hospital from 2020 to date after they had consumed aluminium phosphide. Patient admission ranged between the average of 5 cases a month. The department condemns the illegal selling of this poisonous substance as it leads to a higher risk of mortality when consumed by humans.
The access to aluminium phosphate is of huge concern.
I want to suggest that South Africa does something in terms of perhaps stopping the manufacturing of this chemical so that children do not have access to it. Because even if we can talk about restricting it in terms of being available or not being available over the shelf or over the counter, our people will still make a plan. People need to bypass a very serious laws of the country. This one is nothing as compared to what people of South Africa would do in the black market.
Health professionals say the trend of using this chemical is alarming.
Previously, we used to see or to have a mortality rate of 100% when a patient ingests this drug. But this has significantly come down to about 50% after we introduced the ingestion of cooking oil 6 hours post ingestion of tank pill. That has improved the mortality rate significantly. So I think the best thing would be for government to control its availability in the streets to make sure that it's not easily available, readily accessible by everyone in the streets.
The provincial government says research needs to be conducted into the distribution of the chemical.
But we are worried by the rate of suicide due to that tablet. We are saying laboratories that we have as a country must check exactly why is this so strong to the extent that it killed people. We understand the farmers are using that tablet for a good purpose, but there is an unintended one now of our kids murdering themselves using that same tablet. So we want to appeal to sectors that are dealing with research to do a proper research to prevent this killing of our kids.
The use of aluminium phosphate as a method of suicide was documented as far back as the year 2000, but in a very small numbers. But now, the alarm bells are ringing. Nkululeko Nyembezi, SABC News, Mthatha.